Hi, this is Dr. Cliff Grunseth coming to you with another Dr. Cliff's Riffs. Today I'm going to be talking about personalized medicine and precision medicine. How medicine's changing. It's no longer a one size fits all kind of medicine. It's actually getting much more personalized. Everyone has a different type of body, style, size. And so rather than just assuming everybody is the same, there are people who are just different. And we're trying to figure out how to personalize and to really be precise about what your needs are. The genetics define your makeup and how you may respond or how you might age or react to certain medications. But there's also psychosocial factors that affect everything about your health, including how you react to certain types of stresses and conditions. The bottom line is that it requires data, and there's lots of ways to get more data these days, simply because we have more tests available, and it's getting more and more detailed about what we can find out. So it's not just, oh, you're getting old and that's all, you just have to wait until you're kind of old and decrepit. We can sometimes try to really target certain conditions and try to keep you as active as we can, regardless of your situation. The biggest fear that people have oftentimes is really the kind of the brain and the how well your body's going to hold up. Sometimes it's genetic, as you know, and other times there are ways to try to prevent or push things down the road so they don't develop. For example, people with peripheral neuropathies, which is basically the long nerves of your body that go into your hands and your toes, your fingers and your toes. There's a genetic predisposition to having the nerves kind of wear out over time, but there's also simple vitamins like vitamin B12 that can sometimes prevent the progression of that type of condition. And some people don't activate the B12. So genetically, they should take the methyl B12 because that will then already be turned on and it will have an effect, versus if your body genetically does not activate that vitamin, it doesn't turn into the active form. And so then it doesn't really do anything for you. So those types of personalizations can make a big difference in how you season. People with arthritis can sometimes run in families, but there's also biological or I should say biomechanical factors that can affect how fast things wear out. For example, if you tend to run with flat feet and flat feet, but if your mechanics are such that you wear out the outside of your knees more than the inside just because of the angle of your legs, just personalizing it, identifying that early, providing some orthotics which support the arch, which biomechanically will help load the joints symmetrically so you don't end up with an asymmetric wearing of one part of the joint and the other part is still youthful. This is almost like running your car with tires that are malaligned. And if we can figure that out, we can personalize the biomechanics for you, you can oftentimes prevent the need for a joint replacement, etc., 10 or 20 years ahead of time. The other part that we use for personalized medicine and precision medicine is ultrasound. As you know, ultrasound is really just harmless sound waves that are sent into your body. We record and we look at the reflected waves that come back, and we interpret to define if something is broken or torn, and also if it's something is hot and inflamed. The use cases, as you know, for ultrasound is the traditional use cases are looking at hearts. You can use it for looking at blood supply, for example, for people with atherosclerosis or calcium deposits in their carotid arteries. You can use it for evaluating for gallstones or kidney stones. And then, of course, OBGYN for assessing pregnancy. In fact, I love ultrasound so much, I started a nonprofit organization to help women in remote areas of the world get access to people that know how to use ultrasound so that those women who have a high-risk pregnancy can be identified and triaged out of the village. In other words, identified and sent to the local hospitals for more advanced testing or more advanced care, and literally the ultrasound can save their life. And the beautiful thing about ultrasound is it's no longer just a big box machine that you're used to, but it can be the size of an electric razor. This is an ultrasound machine, which is now portable. It plugs into a phone or an iPad, and you can use that, and you can carry that anywhere, and you can use that to identify people with problems in rural, remote areas of the world. Ultrasound is nice because it penetrates deep into the body. There are some limitations. It doesn't bend around curves to look inside of joints like an MRI can see, but it actually is real-time dynamic imaging, and you can see things moving in real time just with sound waves, totally harmless, and identify things that you otherwise may not have seen. And it can be used at the bedside. For example, you can use it to identify pneumonias or COVID. You don't have to send somebody for an x-ray because there are certain patterns on ultrasound. In this case, for example, this is a pneumonia that can be identified just with a simple handheld tool right in the clinic at the bedside. That is so powerful because it's immediate and safe and can be used to help identify a problem, direct people in a certain care, maybe more testing, treatment, etc. We use it a lot for orthopedics, for looking at muscle and tendon tears, joint problems. You can see tendons, bone fractures, fluid in joints, and we use it oftentimes to identify if something is inflamed. For example, in this picture, you can see this tendon is pretty angry. This is blood flow inside of a knee tendon that shows exactly what the source of their knee pain is. Right at the bedside, totally harmless. You can see things even MRIs don't see as well sometimes. You can, for example, this is a picture of somebody's cartilage on their knee. You can see the thick black layer here is a fairly healthy, thick cartilage, and you can see how thinned out the cartilage is on one side of the knee. You may not see that with an x-ray or possibly with an MRI or even a small little bump. In this case, you can see this little ridge is a sign of an old injury, and you can see there's no cartilage right there, and that may be the source of the pain, even though the x-ray and the MRI really was read as, quote, normal. You can even identify systemic diseases like gout. In this case, this is a representation of pseudo-gout, where you have little crystals that are forming inside of the cartilage. You may not see that on an x-ray or an MRI. The other beautiful thing about the precision of ultrasound and the personalization is that you can use it to inject things. You can see where the needle's going, where the medicine is going, and we use that for almost all of our body injections, at least for the peripheral joints and the tendons, because you can see exactly where the target is and where the medicine's going. So the precision of ultrasound is beautiful. So the medicine's changing, we'll get more and more blood tests, and the technology for ultrasound and everything else is, as you know, changing so rapidly, but there's availability of personalized and precision medicine right here today that you can find. Hope that's helpful for you. Hope that keeps you moving. Have a great week. We'll see you next time. Let us know if you have a specific topic you'd like us to discuss. Take care.